Thank you for taking the time to participate in our presentation today. I'm excited to introduce the Nav USA Epic program, which stands for Employee Preventive Integrative Care. Our core philosophy is simple: navigating your benefits, empowering your health. Today, we're going to look at how we can significantly upgrade your corporate benefit package, improve employee health outcomes, and actually create substantial tax efficiencies for your business, all at no net cost to the company or your staff. For example, if we were working with a company with 100 employees, they can save approximately $68,000 a year in corporate payroll taxes while simultaneously giving every employee a boost in their take-home pay, all at no net cost to either side. So what exactly is Nav USA Epic? It's a comprehensive preventative health management program designed to sit right alongside your existing traditional group health insurance. We don't replace what you have, we simply enhance it. The program prioritizes and incentivizes proactive care by keeping employees engaged in their health. We help to motivate and mitigate major medical issues before they happen. At the same time, the structure uses the IRS codes 125, 213, and 105 to unlock tax efficiencies for both sides. Crucially, for your peace of mind, the plan is fully HIPAA compliant and backed by a built-in legal protection plan. This legal protection plan was specifically put in place just in case you should be audited by the IRS. We have a $500,000 plan in place to help you with those legal expenses. Now, we know that wellness programs often get a bad reputation for low engagement and unproven results. Nav USA Epic is entirely different. Our system uses award-winning third-party validated AI and care navigation. As you can see from the timeline on this slide, our algorithms have won consecutive Gold Health Value Awards from 2019 through 2026 for population health management and AI-driven health innovation. What does this mean to you? It means that our technology is clinically proven to predict future medical issues, forecast their costs, and actively reward employees for staying ahead of chronic diseases, improving your bottom line at zero net cost. So let's look at the hard data. According to the data from United Healthcare, a mere 15% of individuals drive 85% of corporate healthcare costs. Even more alarming, 59% of next year's high-cost claimants come from this year's low-risk pool. These unmanaged risks are ticking time bombs. In a standard population pool of roughly 600 cases, look at the potential financial exposure. Nearly 1.1 million for male coronary heart disease, another 971,000 for back conditions, and over 500,000 for hypertension. The total pre-disease risk burden averages out to $8,250 per participant. Now, Nav USA Epic flags these risks early so that they don't turn into catastrophic high-dollar claims on your health insurance renewals. Show you real-world impact. This 5-year case study illustrates the sheer volume of chronic and acute diseases our validated algorithms have successfully averted. Now look at these numbers. Over 3,800 cases of hypertension managed, 1,900 cases of type 2 diabetes averted, and hundreds of cancer and stroke risks flagged early. This isn't just about spreadsheets. It's about saving lives and preserving your workforce's productivity. And this is done because everyone who participates in this program goes through a chronic risk assessment at the beginning of the program. This helps us to identify these red flags that can potentially lead to medical crises, causing a significant impact to your bottom line. Now let's summarize exactly what this brings to your leadership table across 5 core pillars. First, we unlock robust health benefits like telemedicine and health coaching. Secondly, and third, we use smart outreach and targeted communications to ensure employees actually participate. Their communications are based on the results of the risk assessment that they took at the beginning of the program. And finally, pillars 4 and 5 focus on the financials. Employees see a boost in their take home pay, while the company realizes substantial payroll savings. Now, when we sit down with your HR department and your staff, here is the robust care suite that we are adding to their lives at no cost to them. They get personal health dashboard to track their wellness alongside unlimited 24/7, 365 telemedicine with zero copay for their entire household. We also provide unlimited coaching with registered nurses via our holistic health coaching platform, a full employee assistance program, and wellness style lifestyle apps. To round out the peace of mind package, we include the identity theft protection and $10,000 guaranteed issue group term life insurance policy. Now, how do we ensure compliance and results? It's simple. It's a 3-step monthly cycle driven through the personal health dashboard. Step 1, monthly participation employees complete through just one click of preventative activity or health option per month. And in month 2, we strongly recommend that they complete that 15-minute health risk assessment that I told you about to establish their health baseline. And in steps 2 and 3, we provide ongoing bite-sized health education like Health e-News to document their engagement while they easily manage everything inside of their own personal portal. So let's look at the math from the employee's perspective. Using a standard $15 an hour worker making about $2,600 gross a month. By utilizing the Section 125 pre-tax deduction of $1,200 for the preventative plan, their taxable income drops from $2,600 to just $1,400. This slashes their total federal, state, and FICA tax withholding significantly. When you factor in the $1,000 post-preventative care reward, their net take-home pay increases by $68.55 per month, giving them an extra $822 a year in their pocket for just participating in a health wellness program. Now, let's look at the benefit from the company's bottom line. Because the employee's gross taxable income is lowered, your corporate FICA tax matches drops dramatically. In this exact same scenario, your annual FICA contribution per employee drops from $2,386 to only $1,285, saving you a whopping $1,101.60 in gross payroll taxes per participant. Now, the Nav USA Epic fee is a fixed $35 a month or $420 a year. And when you subtract that from your savings, the company pockets a net annual savings of $681.60 per employee. And if you have 100 participating employees, that's over $68,000 straight back into your company's bottom line. And we handle the heavy lifting to ensure a seamless implementation over a structured 9-week timeline. Right now, we are in week 0, and we start with an initial payroll analysis to customize your savings report. So your HR personnel would provide us with a redacted payroll sheet, and we will use this to customize your savings report. Now, in week 1, we present a formal proposal followed by a compliance contract and payroll code setup with your provider. And in weeks 2 through 5, and in weeks 6 and 7, are reserved for employee-facing presentations and member communications. This leads to the mandatory 30-day employee opt-out window before we officially go live with the first updated payroll in week 9. To summarize, why business owners across the country are choosing Nav USA Epic, let me say this. It features simple implementation that smoothly integrates with your existing payroll providers. It drives exceptional employee engagement through real financial incentives, and it is layered directly on top of your current health insurance without disrupting it and creating a powerful financial efficiency, building a healthier, more productive workforce. As we bring our discussion to a close, let's look at the strategic overview of the operational advantages and employer-faced returns built into the program. We group these advantages into 2 categories. First, your direct employer advantages, which yield a high return on investment. Simple implementation. We seamlessly integrate with your existing payroll and benefit structures. This means zero operational disruption for your internal team. Financial efficiency, because this creates immediate measurable tax savings for the business while proactively helping to reduce long-term healthcare claim costs. And better outcomes and productivity by predicting and lowering chronic health profiles. We help you to foster healthier, highly resilient, and more active workforce. Secondly, we'll look at the shared program benefits that directly impact your workforce. Employee engagement, because the plan actively incentivizes preventative care participation by rewarding employees for completing their health and wellness activities. We have stronger benefits package because it adds robust, highly sought after health resources like 24/7 telemedicine and life insurance without displacing or changing your current health plans. Finally, I want to share with you what sets the Nav USA Epic program apart from any other program that you've probably encountered. Sponsoring these employee benefits directly funds critical support systems for our female veterans and active military families. When we looked at the financial breakdown earlier, we noted that there is a simple monthly administrative fee of $35 per employee per month. What makes this powerful is what this fee doubles as a vehicle for structural and social impact. 85% of these designated admin funds, meaning $30 out of the $35, are channeled directly into vetted veteran advocacy organizations. Here's exactly what the impact does. $15 is donated to Nav USA. This funds a national advocacy, transition assistance, and comprehensive support services to active military personnel, veterans, and their families nationwide. And $15 is donated to the Roots and Resilience Sanctuary. This directly supports the establishment of a natural healing sanctuary for women warriors and their children. This sanctuary provides vital ecotherapy, vocational training, and housing security programs. By implementing this program, you aren't just cutting corporate tax burdens and improving your employees' paychecks. You are seamlessly embedding corporate social responsibility into your benefits package and driving purpose-driven impact that your workforce can feel proud to be a part of. Thank you for taking time today. Our goal is to guide your organization towards a healthier path, protecting your employees' well-being while strengthening your corporate bottom line. To take the next step and map out your exact corporate savings, let us schedule a time to coordinate initial payroll analysis with our team, and you would just need to provide me with a redacted payroll report and let me know what other questions, comments, or concerns you may have with you at this stage. Thank you, and I look forward to working with you and your company for better health.